This is a dental treatment. So we have a medical disease that's called sleep apnea, and we have a dental treatment uh, called oral appliance therapy. Well, right away we can see that we're crossing the bounds between two healthcare systems or professionals. One being the physician, the other is the dentist. That that's right away a challenge, but here's how it works. You can put an appliance that's a plastic covering that goes over the lower teeth and a plastic covering that goes over the upper teeth. And then these two are connected in such a way that when you put the appliance in the mouth, it pulls the jaw forward. And we've known for some time, if you pull the jaw forward, that opens the pharyngeal airway. Everyone who does cardiopulmonary resuscitation knows that you put your fingers behind the jaw and pull it forward to allow the patient to have an airway. So it's not surprising that we could have some effect on sleep apnea by doing this. And it's quite a well-developed treatment. We know all about it. It's not used a lot, and that's because the physicians don't trust it. They don't use it much because they feel that CPAP is something that they completely trust. They know all about. They know how to get it established in the patient, and so they prefer that over oral appliances, which involve another healthcare professional, totally different from them, that has different kind of training than they have. It involves a treatment that they think doesn't always work, and they're correct. It doesn't always work. It doesn't always get rid of the sleep apnea, and that they're worried that it will have side effects and move the teeth. So these are all reasonable concerns on the part of the physician, and it accounts really for why only 5 to 10% of apneics end up receiving oral appliance therapy as opposed to CPAP. Well, uh, this is where a new advance comes into play, and that's a predictive method called Matrix. Matrix is a product, a device, a medical device that allows testing of the patient during sleep and will allow treatment planning that dramatically improves the efficaciousness of oral appliance therapy, dramatically improves the efficiency of the therapy. First of all, this test result will tell the dentist and the physician whether or not the patient will have an adequate response therapeutically. In other words, does it get rid of the sleep apnea? That's number one, and you'd like to know that before you pay for it, before you go to all the effort of making a custom appliance that you can use nightly for years. Before we do that, we'd like to know that this is going to be a productive exercise, that it's going to get rid of the sleep apnea. And that's what the test first tells you. So it allows you to plan the treatment, and that it says, okay, well, this patient can, in theory, respond to the oral appliance. And really, that's true in about 75% of cases. But except for this test, Matrix Plus, except for Matrix Plus, we have no way to tell in advance whether or not the patient is going to have a favorable therapeutic response, whether or not you're going to get rid of the sleep apnea. So that's the goal here. And if you're going to get rid of the sleep apnea, the test will tell you that. It will identify each patient who is going to be a therapeutic responder. Then there's another great advantage of the test, and that is that it can help the patient, help the dentist in applying the therapy. It's going to guide the dentist because it will inform the dentist as to how much protrusion of the mandible, pulling forward the mandible is required. Is it just a little bit, or is it all the way out to maximum? A key guidance for the dentist, and allows the dentist is a therapist, allows the therapist to move expeditiously and efficiently in configuring the oral appliance so that the treatment will be efficacious, so that the treatment will eliminate the sleep apnea.